My name is Nancy Akeyo. I serve as the CEO of Boda Girls Kenya. And my journey with Boda Girls Kenya is rooted deep in commitment to women empowerment and also equitable access to healthcare, especially in the rural community. So I joined Boda Girls out of my personal conviction and also lived experience to break the barriers around the transport, gender equality, and also harassment around the transport. So this demonstrates that the support, when we give the girls and the women support from any background, and they can rise, they can lead, and also create a lasting change, and just to support their community. So Boda Girls Kenya has allowed me to turn this belief into action through practical community-driven solution. So this program was created to address this gap because it is a women-led initiative that trains women to become health advocates and also to own the business, becoming a Boda Girl as a taxi rider within the community. Okay, Boda Girls program was co-created by an organization called Matibabu in Siaya and Tiba Foundation in the US after a discussion with the girls' school principal about how boda-boda riders sexually harass students, especially girls. And the question was very simple and very transformative. What if the solution is to train women themselves to ride? They earn their income and also to serve their community. So this idea emerged after observing that gap of having women as riders within their community, because we all know that by now we have around 98% of boda riders in Kenya who are men. It is a male-dominated industry, and you find that women are the majority of users of the health services, especially the maternal and reproductive health. So many rural women share especially the maternal and reproductive health. 98% of boda riders in Kenya are men, and women are the majority of the health, especially the maternal and reproductive health services. And you find that these women, they always share their stories about sexual harassment, the fear around that, and also they miss that some visits, because you find that the women should be visiting the clinics around 8 visits, but you find that they only make it to 4 visits because, one, the cost of the transport, and you also find that the distance is too long and they are unable to reach the hostel. So from this idea, the Boda Girls was born as a program where the rural women become trained. We license them to have the motorcycle, to own them, and also to become the health advocates within their community. So it breaks these gender stereotypes while they're solving a real public health challenge within their community. Yes, Boda Girls program, we operate in rural areas in Western Kenya, and currently we are in 3 counties, Homa Bay, Kisumu, and Siaya. So Boda Girls is innovative because it turns the daily challenge, which is the transport, and into the engine of the social change. So our model is creatively waves together around 4 things. That is the safe transport for women seeking healthcare. We also have economic empowerment for the rural women, and also it is structured such that we work with the rural hospital partnership model, where we license the model, we give them the curriculum, we give them the training, we have the M&E, and also we're looking at the health advocacy delivery, where we train these girls to be a health advocate, to navigate and just to walk with these women throughout the journey. So So this transforms a motorcycle into more than just a vehicle, but it becomes a tool for healthcare access. We are looking at the dignity and the income because they change their life and the livelihood, and the impact actually has really, we have seen the impact where we have 67% delivery at the facility. We have seen the maternal clinics double up and also a significant increase in the family planning and cervical cancer screening. And we have seen these women earning dignified income from $1 to $8 a day. So this, for sure, it shows that it is an innovative program. I think it is a dual role, which has really been a game changer within the community where the Boda Girls operate. This is because the Boda Girls are trained. We have around 15 modules curriculum in 4 areas. We are looking at the life skills, and we are looking at the patient navigation and business skills and leadership. So when we talk about the patient navigation, we are looking at the maternal health, cancer screening, and also the gender-based response. So this actually has really changed the life of these girls, as same as saving life within the community. And of course, more than 10,000 women have been reached with these services that we give for free. At first, there was a surprise, of course, and in some areas, you know that in some regions in Kenya, there's this culture and myths around women riding, okay? And also the resistance, because this is a space where the people know that it is for male, and never imagined that women can occupy this. But as communities witness the professionalism of these women and the income that they make, yeah, and also the impact that they have within the community, the perception began to shift. And also, we are having a program which is called the Male Ally. At the beginning of the program, we engage the men who are going to support these women, and they become Boda Girls Ally, who are there to work together with our girls, supporting them in case of maybe they have challenges in the field they can reach. So today, male riders, I can say, have become allies rather than just the competitors, because at the beginning, they thought these are the competitors, yeah? But as they see these women are carrying their sisters, they're carrying their mothers, they're carrying their wives, and they see them as the community leaders champions, okay? In families who are initially hesitant now, take pride seeing these daughters, the wives and mothers riding confidently and saving lives within the community. Yeah, we have seen these women making dignified income. When they started the program, you find that there are some who are our housewives. There are some who didn't have any job. Some are single mothers and they do odd jobs. As they start to ride, they make good money. And we have seen an increase where they earn between $8 to $10 a day. And they are able to support their family. They take their children to private school. They will have the side hustle where they employ other women to sell in their shops, and they pay. That is a sign of increase, and also we see the impact that they are making within their family. The challenges are there, and like any pioneering initiative, we have faced the challenges. starting with the maternal health crisis, which is affecting many counties. And when you look at the report from the UNICEF, we have over 5,000 maternal deaths and also 30,000 infant deaths annually. So you find that many women are still giving birth at home due to distance costs and also the transport and delays reaching at the facility. Besides that, there's also the gender inequality, where we have this gender stereotype. And people ask, the women's ability to ride. They don't believe that women can ride safely. And also the limited to education. Many women that we recruit actually, few are graduate from high school. And that shows that there's still a gap when it comes to the education. And what we do is just to have a strong training in riding skills. We are looking at the business, we are looking at the financial literacy, just to ensure that they are well equipped and they have the knowledge. So there's also a challenge on the restriction on decision making, especially at the household level, where the men feel that they are the decision makers. So this is empowering that cultural norms and gender violence by now having this family and the community engage. And from the start, we engage this family and just to inform them, just to teach them, and also make them know that women, when they are empowered, they'll be able to participate in decision making. And of course, we have the unsafe transport, which is a challenge. You'll find that 28% of women report the harassment in transport, but there are 60% have witnessed it. So you find that this is also a challenge that is affecting the industry, but we have incorporated the male boda-boda operators that we call the male ally, have already mentioned. And this is something that is working for us. And when you train them, they also train on gender-based violence. They're also trained on sexual reproductive health. And they're also trained on the first aid because they're also the first responders. And they'll be able to support our women when they are working within their community. I am proud with our women because right now we have around 60 Boda Girls who have active trained in riding and saving lives within their community in Siaya, in Homa Bay, and in Kisumu. And my hope is that in the next 5 years, it becomes completely a norm to see women in transport, not as an exception, but also as leaders, the trainers, and the business owners. And also we want them to be the policy influencers. So Boda Girls Kenya, in the next 5 years, we aim to scale this across Kenya. And we are looking at having 40 rural hospitals onboarded. We are looking to work in 14 counties and also train more than 800 Boda Girls, and we want to reach over 1 million women every year with safe transport and also free transport of the services that we offer.
My name is Mishka Achieng Odira, a Boda Girl rider at Med 25 Hospital in Homa Bay. I have a son 3 years old. I'm still single, I'm not married. My name is Wendy Irene Opio. I'm a Boda Girl at Med 25 Hospital in Homa Bay County. I am a mother and a wife. I have a son who is turning 1 year next month. I'm also married. After my O-level education, I had to go to college Then there was no money. My other siblings were in colleges, others were in high schools. So there was not enough money to go to college. Then me and my parents, we came up with this training as a tailor at someone's shop, which I had to use transport from home to the shop every day. This made me to miss some classes, some lessons. And then my son was to join preschool. There was not enough money. So that was my life. Before joining Boda Girl, I had so many challenges and I faced so many challenges. One, I suffered financially, being that I was not able to support myself, support my family back at my father's place. Being that I was the firstborn child, I wasn't able to support them. And also at my husband's place, I'm also the first daughter-in-law. And the challenge was I was not able to support them and even support myself, support my kid. The only thing I could do, like my daily basic was just to stay at home, wake up, doing the house chores, maybe helping the family to maybe cleaning and all that. Okay, I first heard about Boda Girls through my assistant chief in my village. He announced this to churches. He came to our church and announced that there's an organization called Boda Girls, training young women and girls to be boda-boda riders. And so that's why I was motivated. When I joined this, I thought to myself, if I become a boda girl rider, I'll be able to save some money to go to college because that was the main aim. My son was going to join school. First, I heard about Boda Girls program through one of the staffs from Med 25 hospital. And when I heard about it, I was interested. And so I inquired more from him. And he explained to me about the Boda Girls program, which was to come soon. And being that I was suffering financially, and I needed something to do. Like I needed a change in my life. I felt like I should join Boda Girl, and I saw it like the only thing that could make my life change. Okay, my life has changed through so many ways. As we are speaking now, I've started saving money for school. My son has joined preschool. He's going to school right now, and I hope that I will be able to have my own tailoring machine. Now, after joining Boda Girls, I see myself respected. I see myself as an independent woman who can depend on herself. And also, I see myself as someone who can also assist and help fellow women in the community. And also, I see myself as a young woman who can provide care for my family. And also at the same time, I can provide for my son. I'm carrying women and girls. This has reduced GBV in the community, gender-based violence, because earlier we said that when the boda women were carrying girls, some were being raped, some were defilements. It has reduced that in the community. Through carrying them, it has built trust with the girls and women. This makes the women reach the hospital faster when there is an emergency. The impact that has promoted me as a Boda girl. Being a Boda girl, I create awareness in the community. I educate my fellow young women and also tell them the benefits of attending their 8NCs, the 8 antenatal clinic, the benefits of delivering to the hospital, being that it's a safe delivery, the benefits of coming for the cancer screening, the benefits of family planning, and also the benefits of the post-natal clinic. And another impact, it has also promoted me to be an independent woman. Like being a Boda girl is a source of income. So it has made me an independent woman, like I depend on myself. Another one, being a Boda girl, it has also made me be an empowered woman. Like generally, the Boda Girl program entails empowering women. So it has made me be an empowered woman. And at the same time, being a Boda Girl, I also make my fellow women in the community be empowered. Another thing, back in the community view me as one of the role model, being that I'm one of the Boda Girls. Okay. Riding is safe. Riding is fun. A woman can ride because women are so keen. They are professional. They have all the gears that are needed for a motorcycle rider. And riding, anybody can ride. Yeah. The community now views Boda Girl differently because when it was announced, they were like, how can a woman ride? They really viewed it as male dominated, but now being that the community is healthy, women are attending all their agencies, they know their cancer screening, they deliver safely to the hospital. This even makes the community more supportive of the Boda Girls. Yeah, and they are willing for Boda Girls to be bigger. Yes. Okay, generally before Boda Girl came, the Boda riding was only done by men. And back in the community, they believed that riding motorcycle is something that should only be done by men. But when Boda Girl came, they saw it like something awkward, something that should not be done by men. And most of the men in the community, they said that no, our women cannot ride, and they neglected their women from joining Boda Girl. But after being one of the members of the program, and we also created awareness in the community, telling what Boda Girls are doing, what the benefits of Boda Girls, they saw it as like something that should be there. And they also encouraged the Mate 25 facility maybe to come up and add more girls to ride, being that Boda Girls has made the community become healthier, and they see women like people who can ride and can do their things alone. Okay. My hope for the future is that my son's schooling will be perfect. I will be self-employed. I will be able to buy my own tailoring machine, and the community will also have a voice. Women in the community will have a voice one day. I want to encourage the young girls and women that I did it so they can also do it. It's not something that's too difficult. If I did it, you too, you can do it. You will see yourself as a role model in your community. You will be self-employed, you will be independent. You will be respected, you will have a voice in your community, in your family. I want to encourage them to it's not too difficult. I did it, they can do it. Yes. My encouragement to my fellow young girls and women is just to trust in God and maybe hope that they can do it. They don't lose hope for the future. And to all girls and young women who want to join Boda Girls, I can tell them that let them hope for the best. They can join, and Boda Girl will make their life change because it changed my life from zero, and I can say that now I'm somewhere.
I want to tell the women everywhere, my message is very simple. Your ideas, your voice, and your leadership matters. And innovation is not only found in technology or big institutions. Sometimes it's found in the village where we have these women on motorcycle in the courage of a woman who chooses to rise. And they will rise. If they're given the right tool, they'll be able to change this world. So we provide women with these tools and we trust them and we give them the opportunity. They will not just transform their own lives, but also will transform the entire system because they're empowered and they have the skills to ensure that they save lives within their community.
We are the Boda Girls. The road is ours. We did it. So can you.